Good evening. A hospital surgeon is under investigation over claims that he harmed patients while treating them for facial and skull injuries. An internal review of the work of Roger Bainton has so far concluded he was likely to have caused harm to 18 people.
Mr. Bainton is currently suspended from his job. 14 years ago, he was reprimanded following the death of a patient in Scotland before he was recruited by health officials in Staffordshire. A warning: Keith Wilkinson's exclusive report contains some graphic images from the start.
Terrible injuries on the face of Chris Simpson after what he says was an unprovoked attack on him in a pub where he was working as a DJ. He had surgery in hospital. The surgeon was Roger Bainton, pictured here 14 years ago.
Just to the above my eyebrows there, down the left side of my nose.
Mr. Simpson says he thought he'd done a good job and he was grateful.
Initially, for about the first 4 years after the first operation, everything seemed to be perfectly okay. And then I was called back to the hospital for an ad hoc sort of check-up around about 4 years after the initial operation was done, which seemed a bit strange because I wasn't having any complications at that point.
At the University Hospital of North Staffordshire, he says he was told by Mr. Bainton that there were problems and he needed to have a titanium plate inserted behind his eye. After that operation, he says, things went badly wrong for him.
Pretty much from that point on, I had really bad double vision in my right eye. I now find myself okay looking at people straight on, but if somebody shouts me from the side, I'll have to look across at them to see them. I'm not able to glance at people anymore, because if I glance round or look around, then my vision goes completely out. I do suffer a lot with nosebleeds now, and I also suffer quite a lot with headaches, perhaps 2 to 3 times a week. You know, regularly taking paracetamol to keep headaches and stuff away.
Breathing problems all the way down here, and the pain I get.
Donna Dillon was also a patient of Roger Bainton. She too says she needed facial surgery after being assaulted.
He operated and he said everything went well, but I was still in a horrendous lot of pain, and I still am, 7 years on, still in a lot of pain with my nose and my eye. Breathing at night is terrible. I really do struggle. I have to breathe through my mouth, which I end up with a dry mouth. My eye is very, very sensitive to light. It really does go blue quite a lot of time, which, when it does happen, I can't drive. It's not nice. It's like somebody's got a hand over your face all the time. You just can't breathe. You get a lot of nose pain here and across your eye. You've got headaches. You can't sleep, so you're miserable and tired the next day. I can't remember the last time I had a full night's sleep, pain-free, basically.
Mr. Bainton has been suspended by the hospital since February 2013. The University Hospital of North Staffordshire NHS Trust has so far reviewed the cases of 88 patients and has concluded that 18 of these were likely to have been harmed to some degree. The NHS Trust has told us consultants who reviewed Donna Dillon's case did not feel harm was caused to her. And regarding Chris Simpson, the Trust says he was part of the 88 reviewed, and the consultants also concluded in his case there was no harm caused. The 2 patients say they're unhappy with that assessment. An earlier Royal College of Surgeons investigation concluded that patients it had reviewed were at least not helped and at worst had come to harm due to the standard of care provided. The RCS says Mr. Bainton did not follow best practice when he used a bone substitute called DBX to treat some patients with eye socket injuries because the product was not licensed for that kind of procedure. The RCS said some patients had suffered harm because of surgery that had been carried out when it was unnecessary. In some cases, says the RCS, non-surgical measures should have been used instead. Medical lawyer Karen Reynolds says she's representing more than 40 people who were Mr. Bainton's patients.
I have 2 clients who had eye socket surgery 13 times over a period of 4 to 5 years, which is completely unacceptable. I also have 3 clients who had minor symptoms with their jaw, who all had surgery. 1 has now had jaw replacement surgery, and the other 2 have been told that's the only option.
At the moment, those particular allegations of substandard treatment remain unproven. But it's not the first time Mr. Bainton has been in the spotlight.
Mr. Bainton, what's your reaction to this? My client would like to read a statement he's prepared.
Back in 2000, he was reprimanded by the General Medical Council for professional misconduct following the death of a patient in Aberdeen.
This tragic incident has caused me very great personal anguish.
And ITV News Central has seen a letter from the Trust which says it was aware of this before he was appointed in North Staffordshire. The Trust has declined to give an interview while his cases are still under review. A spokesman for the hospital says,
"I wish to extend my profound apologies to those patients who have been harmed by the particular treatment received. They can have absolute confidence that they will receive the best possible care and treatment from our senior oral and maxillofacial consultants, who are rightly proud of the exemplary standards that they set themselves and for their department."
Mr. Bainton was asked by the Royal College of Surgeons investigators about problems some patients developed following his use of DBX as a bone substitute in eye sockets. He told the investigators that stroke patients aren't particularly average. There is a high incidence of drinkers, smokers and drug addicts, a claim the RCS review team did not accept. Despite the criticisms, the RCS report describes Mr. Bainton as a very technically able surgeon who worked long hours and was passionate about patients. And last year, an internal report by hospital managers rejected some of the complaints against him, saying there was no evidence Mr. Bainton had demonstrated poor clinical insight. It said Mr. Bainton had used his DBX technique in good faith and after discussion with others. Initial results, according to Mr. Bainton, were encouraging and he had abandoned the procedure when concerns came to light. We asked Mr. Bainton for an interview or a statement, but he declined. Some of the people he treated, however, are looking for answers. Meanwhile, the Trust is contacting another 36 patients to review their cases. Keith Wilkinson, ITV News.